Welcome to the Mindset Mirror Connection podcast. In today's episode, I talk with Dr. Kaitlyn Kakar with Thriving Mamas. She's a local pelvic floor PT here in Phoenix, Arizona and Scottsdale, Arizona. We're going to talk about what the pelvic floor is, what a physical therapist is, and the importance of her role in your pregnancy and postpartum journey. We also want to talk about taboo topics and so much more. So if you're ready, listen up, lean in, and prepare to elevate your mind. Hey girl, hey.
Hi,
oh my gosh, we are so excited that you're here.
I am so excited to be here.
Okay, so I think I met you, I think I randomly emailed you, probably a year and a half ago?
I think so.
Yeah, that's kind of my thing, is I randomly email and go, hey, do you want to get together? Like, this is what I do. I'm also an audiologist, so I'm not just like some train wreck coming off the street. And you were gracious enough to be like, yeah, come to my office. And that was when you were at your older location.
Yes, that's correct.
And so now you're actually closer to me too, which I love. And so just started talking to you, really enjoyed you and thought, okay, great. And then kind of waited. And now we work together on multiple, we've had
a lot.
I'm thinking I can think of 5 off the top of my head. And they've all been super successful. Yes. They love you. And so I was like, let's get her on the pod because you speak so eloquently.
Thank you.
You have such a great social media following. You're really great at educating and you're really great at your job.
Thank you.
Yeah, I was like, this
that.
is the great, let's get the audience aware because unfortunately pelvic floor physical therapy is not mainstream.
Totally.
I think it's getting there and we'll talk about how to do that. But yeah. I want it to be more. And I think you're a perfect spokesperson for it. So tell us about you. Tell us everything.
Sure.
Let it riff, babe.
Let's get to know each other. Okay. So as you mentioned, I'm a pelvic floor PT.
Yes.
I started off in orthopedics when I graduated. So I was seeing neck pain, back pain, wrist pain, treating a lot of runners. I enjoyed that. But then fast forward, my husband and I moved to Australia. I was working at a clinic that saw a lot of pregnant and postpartum moms. Okay. And I was like, this is interesting. This is new. I think I like this.
Yeah.
And one of the physios over there was a pelvic floor physio. And I learned so much from her.
Okay.
And while we were over there, I got pregnant. So going through pregnancy, birth, and postpartum, my eyes were open to the lack of knowledge, education, support to moms during that phase. And I felt lucky that I had started working there because I had picked up on so many things.
Oh, I'm sure.
Past just the basics that we get in PT school. It was a good experience though, because over there, obviously the healthcare system is a little bit different. And with the maternity leave being a year long, crazy, right?
That's another podcast in itself.
We were automatically put into a mom's group that was led by a midwife for probably the first 6 weeks. And so every week we'd get together, talk about different topics.
This was mandated by their healthcare system? Or not mandated, but encouraged?
It was an automatic thing that you just got placed in this group. So we would talk about, feeding your babies sleeping, safety things. And then past that 6 weeks, all the moms would continue getting together for the first year. So it was cool because I had patients that would be like, oh yeah, who are much older, be like, yeah, we all still go on vacation together. So it was such this cool, close-knit group of moms who all could kind of focus on being moms, not having to work at that same time as well. Fast forward, my daughter was born in March of 2020. So we ended up moving back in July, COVID. And so when I moved back, I was like, you know what? I feel this burning passion of I need to help moms like I was getting this help and resources. So I decided to start my own business, which I made it just virtual, low cost starting out. That transitioned to mobile. Then now I'm in the clinic 4 days a week. So it's really blossomed into a growing business.
Yeah.
And the other thing that I have loved too is being able to connect with other providers like yourself in order to give moms all the resources, ideally, that they need and want during pregnancy. And I feel like when you get pregnant for the first time, there's so much that you don't know.
Right.
So you're trying to read books, get some information from friends, what worked for one person, what might work for you. And then kind of once you're in it or you've been through it, you realize that you kind of need a chiropractor, a PT, a personal trainer, maybe someone who helps you with hormones. You need to find a provider. There are just a lot of providers who can really help to support you during this time. so that you have a positive experience.
Right.
And without getting into the cost of the whole thing, because I understand sometimes it's a luxury for a lot of people. But when I was in Australia, pelvic floor PT was just kind of, you go to your OB at your 6-week check. Here's a referral to go see a physio.
Really?
This is just a normal thing that people do.
Whereas here, that's not an
Right.
experience.
Exactly.
The OB is like, you're cleared. And
You're
that's
good
something
to go.
I want to ask you today is like, what is the difference between what you do and they do?
Exactly.
But it's wild because I feel like we use our clients and patients as like, hey, you should tell your friends about all this.
Yes.
Because it's really helping you and you aren't peeing your pants anymore. And I know the OB told you you're good, but you're not. Sorry.
Exactly.
Yeah.
Exactly. And I think that was what I was going to say was I feel like so many of my patients come to see me from a trainer that recommended them, a friend that recommended them, usually not their provider,
Really?
which is kind of a wild thing to think about from PT, because normally, traditionally, it's like you get a script from your doctor, you go to PT, which in the state of Arizona and most of the other states, you can see a PT directly. You don't need a referral to see us. If it's an insurance thing, we can always make a plan of care, send that over to your doctor to get signed to continue to see us. So I think part of it is just keeping that access open to, if you're dealing with things that you know aren't normal for you and you don't want to deal with it, go see someone. You don't have to have your OB or your midwife being like, yes, you go see a pelvic floor PT. And no matter where you are in the world, there's really great websites to help you find where those pelvic floor PTs are if in person is something that you need.
Okay. So we're pelvic PT. We're here in Arizona.
Yep.
What I want to know is you work specifically with pregnancy and postpartum.
Yes.
Because of your experience, I just want to confirm. Okay. So
yes.
Why is it important that they come and work with you during this phase? Why not at some point? Or what I'm trying to ask is, why now? Why now? What is so important about that chapter in someone's life?
Sure. So I will say there is technically no like, and I'm doing air quotes, pregnancy and postpartum specialty.
Right.
So within pelvic health, you can treat men, you can treat women, you can treat kids. For me, I knew that this was the subset of people that I wanted to work with because I had been through it.
Okay.
I was a mom. I'd been through pregnancy. I had been through postpartum. And I think to the average person, you wouldn't realize just how much goes into both of those whole complete processes that you can make a whole profession of helping people just in this small phase of their life.
Right.
So you can still see a pelvic floor PT if you're having leaking, pressure, heaviness, any other pelvic floor dysfunction anytime. So these issues don't just affect moms. But I decided that this was who I wanted to treat. So then all of my continuing education courses have been focused on to be able to best help moms during pregnancy and postpartum. So you asked kind of, why now? Why this time of our life? So I like to equate it to our abdominal muscles because that's something that we can see. So as you're pregnant, your abdominal muscles start to stretch and they lengthen. Our pelvic floor muscles, the muscles at the bottom of the pelvis, they are also being affected. We can't just visually see what's happening. But you can imagine over those 9 or 10 months, there's all that extra weight and pressure going down on your pelvic floor. So not even getting to the birth yet, but just through experiencing pregnancy, your pelvic floor muscles are going to be affected.
Sure.
For some people, this might mean now we're leaking when we're coughing, when we're sneezing, when we're jogging, when we're working out. For some people, they feel this heaviness or pressure that feels uncomfortable, which if you're, 39 weeks pregnant and you're feeling some pressure down there, there's some degree, there's some degree of normalcy to that. But if you're in your second trimester and you're like, it just feels heavy down there all the time, go see someone. We can help you figure out why you're experiencing those symptoms. What can we do to lessen those things? And I think for so long, women have dealt with these pelvic floor issues. They've been taboo. We haven't talked about it. We just kind of deal with it. So for me, it's so exciting. And I get so fired up about it because there is something we can do about these things. You hear from your mom or maybe an older sister-in-law, oh yeah, I just leak a little bit when I pee, or I just wear a pad when I work out. Like, how did you deal with those things for so long? Like, go do something about it.
Well, and I think, but to your point is they didn't know they could do something about it. I remember the first time I heard, I was at a CrossFit gym and so we were going to do double unders, right? And double unders are jumping rope essentially. And these moms all lined up by the bathroom right before the workout was supposed to start. And I was like, what? Yeah. Like, and of course I'm like 22 at the time. I'm like, what? And like probably hungover. Like, what's going on? And they're like, oh, you guys will get it when you're older. And I thought, the fuck I will. Like, I don't want to be peeing my pants when I'm older. Like, especially if there's something I can do to help kind of
100%
mitigate it. So, okay. So we're going into pregnancy and postpartum.
Yep.
This is where pelvic floor, I think, really is brought up. A lot of people are not thinking about it until this point.
Yes.
But now we're starting to pee our pants. We're feeling this heaviness.
Yep.
Our abdominals are coning or doming. That's another one I see too.
Yeah. Yeah.
So when someone's like, okay, a pelvic floor PT, I'm learning about it. What is like your experience with clients and walking them through the, let's say before pregnancy, going into postpartum, how do you manage those appointments? Because what I think a lot of the things is you talked about the chiropractor, OB,
how do I have time for all this?
How do I have time for it? And I think it would be really great for you to share, like, it's not that much time.
Yeah, it's true. So, and again, I can only speak of my practice, how I treat. Every pelvic floor PT treats a little bit different.
Yeah.
They have a different philosophy. And I think at the end of the day, you have to find someone that you connect with and you work well with. So for me, I've started to see some moms as they're trying to conceive to kind of learn the basics. I want to teach you all the things about your core before you get pregnant so you know what things feel like from your baseline. Let's learn how to breathe. Let's learn how to turn on your abs. Let's learn how to turn on your pelvic floor. Let's learn how to turn off your pelvic floor. Let's make sure you have good hip mobility. Let's make sure you have good thoracic mobility. And I know I'm kind of rattling off these things. It will make it will make more sense as we start talking about what happens during pregnancy and postpartum, but not that we're having a cookie cutter treatment here, but a lot of similar themes kind of come up with pregnancy just by the way that our bodies naturally grow this baby, what happens to our hips, what happens to our upper back. So these are areas that I see over and over and over again that we need to make sure that we are addressing even before we get pregnant to make your body in the best, I don't want to say shape, but as best it can be before you get pregnant.
Yeah, like a morph. I want my body to be able to morph with pregnancy. And if I'm not aware of how it needs to morph, I'm going to do myself almost a disservice.
Yeah, and so exactly. And so a lot of moms will come in postpartum. And when we start talking about pelvic floor things, they'll be like, yeah, I remember like I used to leak when I laughed when I was in high school, or I remember feeling like I had to pee all of the time. And then the little light bulb goes off of like, oh, I might have had some pelvic floor stuff then. So if we can now address it prior to getting pregnant, okay, let's address those things. Let's see if we can treat those things first. And I think a lot of it is just the education piece. You know, no one's telling you about these things. Your OB and your midwife isn't going to talk to you about diaphragmatic breathing and how your diaphragm relates to your pelvic floor and what that means.
No, they're like, did you get an STD today? And you're like, I hope not.
Exactly.
Can I just get my UTI fixed?
Right. So I feel like we are very much the ones providing this education. So I might see you once when you're trying to conceive. I might see you a few times. It's obviously going to depend on, do we have a lot of things that we need to work through? Are you having any symptoms currently? Or are you just really trying to be preventative to make sure that you're in the best state, we'll say, as possible going into pregnancy? Fast forward into pregnancy then, the first trimester, I feel like you've got a lot of changes as you find out you're pregnant. You might be super sick and nauseous. You might not feel like you're working out at all. So there's a lot that your body is going through physically and mentally. Do I necessarily need to see you in your first trimester? Maybe. That's kind of up to you.
Sure.
If you want to start, be proactive, see what you can continue doing in the gym, what you might need to modify, that'll kind of depend too on how big the belly is growing. So maybe a first-time mom, you might not be showing a whole lot. For a second-time mom, you might start showing it 6 or 8 weeks, and that's going to affect those abdominal muscles. So we'll start to talk through, what is pregnancy going to look like? What might be modifications that you're going to make? You mentioned the coning and doming of the abdominal muscles. So I find that a lot of what we'll talk about during pregnancy, especially, that first and second trimester, is I've heard this on Instagram. I've heard this on TikTok. I've heard someone else talking about these things. How does that apply to me? Do I need to be worried about it? What do I need to do? Can I do this? Can I not? So it's coming to someone who has education to be able to tell you what you need versus
you as an individual.
Versus this is just kind of like a blanket statement for what everybody needs.
And would you say, so most of the information these women are getting are from social media, are from their friends? And
say so.
Their friend might have gone to pelvic PT, maybe not. Maybe. And so it's really interesting that, again, that outsource of information is at least there.
It is.
But and I think that's probably one of the first steps is, okay, at least there's an awareness. And now if there's an awareness, we can have a recognition that what can I do for myself? And I don't want to fall into these behaviors or traps, or I see like my mom who has to wear a diaper at 60 years old and she's in great health. So, okay, interesting. So now we're pregnant. We're coming to you. Let's say my issues are like, I'm good. Like I'm not really experiencing anything. When do I check in with you? What do we do?
I come in second trimester. Okay. So I'd say second trimester is when we're starting to notice more of those body changes. Sure. We might notice, the weight that we're lifting is feeling extra heavy, or the core exercises that I was once doing, they don't feel good, or I don't know if I'm turning on my abs right, or are there better ab exercises that I should be doing? Is there additional things I need to add in? So we want to assess your body. We want to look at, okay, for the active population, I'm assuming you're already exercising. So let's take a peek. What does your squat look like? What does your dead look like? What core exercises are you currently doing?
Hello, listeners. Coach Amanda here. For July, we are letting you know that our August cohort of the Mindset of Mommy's 8-week program is launching. So for this program, we are going to focus on your health before and during pregnancy through education, support, and confidence. In this program, you can expect to have more confidence for pregnancy by learning the benefits of movement and having a structured program to follow. The program will be 2 to 3 days per week, along with beginner and advanced movement options. In this program, you can also expect to increase your nutrition quality with personalized coaching from yours truly. We'll gain awareness to the changes you'll experience mentally, physically, and emotionally during pregnancy, create a strong network of support by learning about a diverse range of professionals to include in your health during this time, as well as gain education on testing done throughout pregnancy. There'll also be a toolkit of resources that includes PDF documents, additional literature that I recommend, podcasts, and social media pages that support your healthiest pregnancy yet. On top of this, you'll get weekly community group calls, weekly written reviews, and our private forum to engage with other like-minded women. You can sign up for this program today for $3.99, and we will start our August cohort August 5th. So if you're interested, please visit mindsetofmommies.com to get more information and to sign up.
I want to know what your ultimate goals are. Like through pregnancy in your ideal world, what do you want to be able to do? Okay. And do we think together that that will be realistic? Or what do we need to watch out for that might be little signs and symptoms along the way that we might need to reel back a little bit? So if I can prevent your SI joint pain, your SPD pain, your back pain, let's do that.
What is, for the audience that doesn't know, what is this? I'm going to, sorry.
Thank you.
What is SI joint pain? What is SPD pain?
Yes. So I'm going to pull out my pelvis and I will describe
This is my favorite thing.
more specifically for those who are listening. So when we think about our pelvis, you can think about the two sides of your pelvis.
Sure.
Or if you put your hands on your hips, it's kind of the top of the pelvis. Both of those bones connect in the front, your pubic bone. You can have some dysfunction, so SPD pain, right in that joint. Some people will call it lightning crotch, is a way that I feel like most people will refer to it. Patients will tell me it either, feels like a lightning bolt in their crotch, someone punched them down there. It's not a pleasant sensation. It can also refer pain downward, so like down towards your inner thighs. You might also feel pain referred into your pelvic floor muscles. So now I'm pointing at the muscles at the bottom of the pelvis that go from that pubic bone in front all the way to the tailbone in the back, and then on both sides of the sit bone. So if you're sitting on a chair right now, in between those bony points, that's your pelvic floor muscles.
So I would say those wiping from front to back.
Yes, that's a good way to put it
in a non-medical way.
Yes, I love that. Everything right there.
Everything from front to back.
Yes, or like if you're sitting on a bike seat.
Yes.
Those are your pelvic floor muscles.
Got
and
it.
Obviously there is skin and tissue covering those pelvic floor muscles, but that's where they are.
Okay.
And then if we look at the back side of the pelvis, you've got your spine, then your sacrum, your tailbone sits at the bottom. So where both sides of your pelvis meet your sacrum, that makes your SI joint, and you can get pain there as well. So again, we've been alluding to these changes that happen to your body. So my belly's growing, my abs are getting stretched. That might start to pull on my pelvis, which causes my pelvis to potentially tip forward. which is going to change how the muscles are pulling around the pelvis. Maybe the glutes, maybe the inner thighs. My abs might have a harder time turning on, and all those things that are attached to the pelvis, if they're not working optimally, meaning providing the stability that they need, the strength, as well as the flexibility, we might start to have these breakdowns, which could look like pain in these areas.
Yeah.
And those are the things that I kind of just picked out that I feel like I see most commonly with pregnant moms. And this could happen whether you work out or whether you don't work out. It is still mind-boggling to me, the moms who I will see who don't work out at all, but never get back pain, SPD pain, or SI joint pain. So unfortunately, doing exercise isn't necessarily like you are 100% going
preventative.
to be good to go. But it will give you a greater chance and likelihood that you're not going to have those issues.
Okay.
What I will say though, the moms who exercise during pregnancy, postpartum is much smoother in general.
I would agree from my experience with working with the clients with you. Yeah.
You want to think about, and I kind of like the analogy, you're training for birth like a marathon or like a sporting event.
Yeah.
You wouldn't just go run 26 miles. You would prepare for that. Hopefully you'd have some strength training.
If you're not, we need to have a conversation.
Right. You do some mobility work.
Yeah.
You'd make sure your nutrition's on point. You'd sleep when you can. Like, you're doing all the things to help prepare for birth. That's kind of how you want to treat pregnancy. And you want to see all the providers that you can to give you a good pregnancy, to then make sure that birth hopefully goes as well as we can control. So then postpartum, you're coming into that postpartum phase with good strength and stability.
Yes.
And you're going to lose some muscle in that early postpartum period because you need to recover. Your body just went through this massive event. I don't like equating birth to an injury, but it kind of is an injury to our muscles.
Yeah.
And so I think when we frame it like that, though, it really hits home the point that we need to have some rest in those first 6 weeks. Okay. This does not mean you are laying in bed for 6 weeks, not doing anything, but this means we are resting.
Yeah.
We're letting our body recover and heal a little bit. But if we can do some movements that are going to help you along in this recovery process, that's what we want to do.
And you have that conversation with your patients
when
beforehand.
They're pregnant, yes.
So they're coming in, they might see you before pregnancy for symptoms they may be having. Okay. So now you're seeing them second trimester, say everything's going well.
Yeah.
Then we're seeing them again and doing like a postpartum prep kind of class. And so that's what she's talking about, is saying like, hey, I actually had a doula that I interviewed yesterday, and she had a really good analogy that I think you'll appreciate.
Oh, yes.
Is she goes, we all have a wedding. Some of us, not me. We're just forever lovers, but we all have a wedding. You find the caterer, you get the wedding planner, you get the venue. There's so much planning going into it. Why isn't birth the same? So why aren't we acknowledging like, okay, so after the wedding, you know which hotel you're going to, you know which lingerie you brought. Why are we not doing that for birth, where we know what our home plan is? We have our diapers ready. We have our movements ready that we're going to do.
Totally.
And I was like, I'm going to take that from you. And she's like, do it. So and that's what Dr. Kakar is talking about here is, hey, here's a great opportunity to better learn your body. Because I think, again, a lot of women are so disconnected from their body. And that could be because of their environment that they grew up in, trauma, the nutrition, diet culture, social media, whatever, name it. And so now you're asking them, hey, we've got to reconnect before. So postpartum, we can hear that and listen to it. So you're seeing them, they're doing this birth prep class essentially, or birth prep, because she also does classes, by the way, people.
I do.
Or one-on-one session.
Yeah.
So they go through pregnancy. They're coming to you postpartum at some point.
I've got to stop you. I
Okay,
forgot
go ahead.
the birth prep side of things.
Okay,
so
go.
We've chatted about it. So you'll find I chat. You guys, I could talk about this stuff for days. I love talking.
Again, her social media is great. Like follow. I cannot emphasize that enough.
Thank you.
You're welcome.
So before we get too far off tangent,
go. Real
so
stats.
you're feeling good. I'll see you in your second trimester. Maybe in your third trimester, you might start feeling more things. Maybe things are getting uncomfortable. Maybe we start having some leaking. We're obviously going to address that. But if you're lucky, things still feel great. 34, 35 weeks. This is, I find, is like prime time to get on the birth prep stuff. So we now want to kind of transition from we're strengthening, we're stabilizing to your pelvic floor needs to prepare to relax and let go. So I think one of the myths is that we need a strong pelvic floor to push this baby out.
No.
That is the job of your uterus. Those intense contractions and sensations that you're feeling is to help push the baby down. Your pelvic floor muscles need to get out of the way. They need to be able to lengthen, relax, let go, release. This is what we work on in pelvic floor PT. Okay. How can we let those muscles go? How can I tell my brain to try to relax those muscles when I've really never thought about that before? It's really hard. Or I've never done that before. We need to practice that. So I'm going to give you, who knows when you're going to go into labor, but if we start at 34, 35 weeks, we should have some good time to be able to daily practice how to let those muscles go. So something tangible that I'll talk about with my patients, I'm going to share with you all today. Free info alert. Right. When you are pooping, okay, we want to think about inhaling down, exhaling down. And as you are pooping, as the poop is coming out, those muscles are lengthening to getting the poop out. Okay. I want you to start paying attention to what that sensation feels like. I ideally am not straining. I'm not pushing the poop out. If we are, that's another issue that we need to address, the constipation. But feel what it feels like to let something pass out of your body in a relaxed way. Okay. Birth, how this equates is obviously that is not where the baby is going to come out. More so when you're pushing, you're thinking about the sensation of pushing a tampon out. Okay. That's the downward pressure, force, lengthening sensation that you'll eventually feel when you're pushing, just intensified. But I find that hopefully everyday habit of pooping and feeling downward pressure starts to get your brain to recognize, okay, this is what it feels like to breathe down, to inhale down.
Do you find there's a certain population that has more of a tighter pelvic floor than others?
I would say yes.
And I think I know the answer.
Share?
That's why
Do you want to
guess? Those who probably lift, those who have high pressure jobs and hold their tension in their jaw, those who are chest breathers. Who else? Am I missing anybody?
Yeah. So I would say the dancers, the runners, the very fit and active population. Yeah. So a majority of my practice, I would say patients need to work on relaxing their pelvic floor.
I want you to repeat that.
Yes.
Repeat that.
Majority of my practice, the patients that I see need to learn how to relax their pelvic floor. Yes. So a myth is that I leak, I need to strengthen my pelvic floor. Not necessarily. You can also have leaking if you have tension in your pelvic floor. So a lot of times you might hear the example like pretend your pelvic floor muscles like a bicep. Your bicep needs length. It needs to be able to stretch out to reach for something. It needs to be able to contract it to bring it back close to you. Your pelvic floor muscles need to do the same thing. They need to be able to fully lengthen and they need to be able to fully contract to function properly, to be able to poop and pee and have enjoyable sex and have a baby and all of those things. We need both. We cannot just focus on one or the other. Good. Okay. Yes. So these birth prep appointments, it is a lot of bringing it back in. Circle. Mind-body connection of feeling what this feels like. Myself, I don't do any internal work during pregnancy. Pelvic floor PTs, we can. That is just something that I have decided for my practice that I don't want to put anything up in there during pregnancy. But there's a lot of things that we can do externally to still get you to feel what those muscles feel like so you know what the sensation feels like to let go. We'll talk about perineal massage. We'll talk about different birthing positions. We'll talk about different pushing positions. I think a lot of people don't realize that even with an epidural, you do have a choice of the way that you push. You don't have to push on your back. You might be able to lay on your side. That's obviously a conversation to have with your provider to make sure they're on board with that. If they're not on board with that, then you have to ask yourself, is this the best provider for me? But I go at it very much from a pelvic floor, pelvis, almost anatomical standpoint of birth prep that's going to be different than the birth prep that you might get at the hospital or
a class
that you would take,
or your mother or your friend telling you.
Exactly. This is very much like, how can we hopefully minimize any sort of trauma to those pelvic floor muscles? What can we do ahead of time to get the pelvis mobile and our hips moving so that those pelvic floor muscles are able to fully relax? If we can minimize the more severe perineal tears, that's what we want to do.
Right.
So it's always so exciting when I see moms during pregnancy for birth prep. We talk about all the things, relaxing the pelvic floor, we're doing the perineal massage. And then I get to see them postpartum and they're like, I only had a grade 1 tear, or I didn't tear at all. I'm like, woo, this is great.
Yeah.
Like, if more moms knew this information, hopefully that would be the case.
Right.
I interrupt this episode to bring you our 2nd July promo, 50% off the Mindset Method Self-Guided Coaching Program. This curriculum walks you through my mindset method to help you recreate a relationship with your body, food, and exercise. In this program, you're going to receive a weekly mindset reflection based in the method: the know, the name, the notice, and the nurture. On top of that, you're going to receive daily journal prompts to help you enhance what you're learning in that week's time. You'll also get access to our community forum, and most importantly, access to a Q&A link where you can get coaching from Coach Amanda and I in this exact podcast on everything you're learning. So if you're someone who's looking to recreate her relationship with who she sees in the mirror, how she trains herself, how she feeds herself, or wants to quiet the food noise or the toxic resilience, click our show notes below to receive 50% off using the code INTRO50. Now, back to the show.
You're getting there. You're getting there.
I will say too, kind of on the flip side of things, we can do all the right things. We can see all the right people. We can do everything that we need to. Sometimes our babies have different plans for how to come into the world. That does not mean that you are any less, that you forgot to do something, that you didn't do something enough. Birth is so unpredictable. So even me, I will admit it, I'm a pelvic floor PT. I know all the things. I had 2 grade 2 tears with both of my girls. For me though, the good thing about being a pelvic floor PT, I now know how to rehab that and how to recover from that. So I think a lot of moms are so scared of tearing, but recognizing there is somebody to help you with this on the other side if that does happen. Same thing with a cesarean birth. A lot of moms are really scared to go through it. Sometimes that's the best way for your baby to come into the world.
Right.
And now I get to help you recover from that, work on your incision, get your ab strength back. And a lot of times and we alluded to this, kind of the postpartum preparation that we talk about during pregnancy, we might talk about, okay, what are some scenarios for a vaginal delivery or a cesarean delivery? You don't get a lot of information on how to get out of bed, how to hold your baby, how to go from sitting to standing, how to get in your car. We can kind of talk through those things ahead of time so that after that happens, if you weren't expecting it, you kind of have your toolbox of like, oh yeah, I remember Kaitlyn was telling me.
You're not like culture shocked.
How to get out of bed. The other cool thing too is I want to be a resource for you that, maybe 2 weeks postpartum, you're really struggling with something. Either you have no control of your bladder, you're in a lot of pain. We can always do a virtual appointment at 2 weeks postpartum. So wherever you are, pregnant, postpartum, virtual appointments are always available. And I tell my patients, please send me an email. Please DM me. Do not Google things in those early days.
No.
Google's kind of a scary place when it comes to postpartum pelvic floor issues, especially at like 3 a.m. when you're feeding your baby and you're like, why does it feel like that in my pelvic floor? Just send me a message. I am happy to answer questions to hopefully calm any fears, but I would much rather you get good information than Googling something and then send you into a spiral of, oh my God, I'm never going to run again, or I'm never going to be able to do X, Y, and Z. Okay.
So you kind of touched on this, and I just want to make sure for the audience that they have some clarity on this. And I think you explained it really well, but just to bring everything full circle back to our timeline of seeing you is we get pregnant. Great. Okay. Things happen. We had the birth. Now we go to OB at 6 weeks ish. Right. And they go, you look great. You're good to go.
Yes.
What is different than what they do compared to what you do? So you're assessing the whole body. You're looking at the movement. Hopefully you've had a working relationship with this client before or patient before.
Definitely.
Sometimes we don't, and that's okay.
Yes.
But what is different in your assessment, and why is sometimes the OB clearance not clear for, yeah. Like why, like for me, when I get a client just randomly reaching out going, OB cleared me, I'm like, yeah, no, I need more. Yeah. Here's some people I need you to go to. Like, I'm still going to see you, but here's like people that we really need to be cleared by, and not discrediting OBs. You're a great practice, but the functionality.
Yes.
Let's go into that.
Let's talk about it. So I don't want to discredit what your midwife or OB is doing, right?
Yes.
Their job is to make sure that you have a healthy pregnancy, they deliver your baby, but then you're kind of good to go at that point. They've done their job. That's their training. That's what they're designed to do. So when you're coming in for your 6-week appointment, they are looking at you from a medical standpoint. Have incisions closed? Has any tearing healed from the external standpoint of nothing's still bleeding, nothing's opening, nothing's infected? They might talk to you about birth control. They might talk to you about mental health, which is great. Their assessment is going to be very quick, but to make sure from a medical perspective, you are, air quotes, cleared. Okay. What that now means from a pelvic floor standpoint, and what we look at is, okay, you've been cleared by your OB. Now let's see the state that your body is in after pregnancy from birth and where things are at. So I usually recommend moms coming in between 4 to 6 weeks postpartum. So if you are really want to get on top of things, you're dying to get into exercise, you want to be super proactive, come on in at 4 weeks. We'll get things rolling. And remember, I will have given you things in the first 4 weeks that you can start working on.
Is this without OB clearance too at this point? Okay. So you don't mind, like, whether they've got it or not, you're like, come on in, let's figure this out.
And I will touch on that. So the things that we're going to talk about in those first 6 weeks, they're not going to be your quote unquote traditional exercises, but I do want you to start breathing again, using your diaphragm.
Breathing.
Yeah. Let's get your ribs moving again. Let's make sure you know how to turn on your abdominal muscles. So these, I'll call them movements in the first 6 weeks. They're super gentle. You're laying on your back, your knees are bent, your hands are feeling different parts of your body. So maybe that's your ribs, or maybe it's your abs, or maybe we're trying to turn on our pelvic floor, nice and gentle. And think of it too, like you're carrying a baby, so 7-8 pounds. You're putting them in the car seat. You're lifting the car seat to take them to appointments. You're a million times a day getting them on and off the change table. So you're moving your body. So the movements that I'm giving you is going to be supportive of that in hopes that you're minimizing the neck pain, the back pain that you might be experiencing. But we're not moving and exercising so much to the point that we're hindering your progress to be had. So, and again, it's always listen to your body. None of these movements should be painful. Nothing should be uncomfortable. But I find that if we can start doing these basic movements sooner, we feel so much better. Recovery feels so much better. I know with my first, I was like craving movement. My back felt so stiff. So even laying in bed, just letting my knees go side to side, or bringing my knees up to my chest, or doing a cat and cow. Like I was doing those things at 2 weeks postpartum. They felt really good for me and my body, knowing the birth that I had. And I would say for a majority of moms I see, the things that I recommend, they're great for you to do. Okay. So now we fast forward to, you've seen your OB, now you're seeing me. I won't do any internal assessments until that 6-week mark after you see your OB. Because remember, we still do want that medical clearance. I want information from them if there is something pertinent that I do need to know. 9 times out of 10, the moms are like, I felt like that appointment was kind of pointless. I didn't learn very much, but we have the clearance. Okay. So now we're going to start looking at, and I mentioned this, kind of where we're left at right now after going through pregnancy and postpartum. So let's check in on your posture. So are our hips pressed forward? Are our shoulders really rounded? Are we feeling some of those lingering things from pregnancy? And we all kind of know the typical posture. The feet are turned out, belly's pressed forward, shoulders are kind of rounded. We almost feel like we're in a slumped position. Remember, the baby was providing some stability to your body. And so once that baby is out, you don't have a lot of core control. So when you stand, you do kind of just feel a little loosey-goosey in there, right? So we talk through, okay, ideally, where could our posture be? We want to look at your breathing. I mentioned our diaphragm is really connected to our pelvic floor. They work together. They're a little piston system.
And what is the diaphragm for
the
people
diaphragm?
that don't know?
Yep. It's the muscle that sits underneath your rib cage, and it's your breathing muscle. So every time you inhale or breathe in, that muscle should expand in 360 degrees and move downward, which applies a little bit of a good pressure down on your pelvic floor. And then both of those things should move back up as we exhale.
Yep.
So as you're sitting there and you're like, oh my God, that's a lot that's going on there. What do
Yeah,
I do on my inhale? What do I do on my exhale? This is what I'm retraining your body to do.
Right.
This is what I'm showing you how to do. And so for most moms, sometimes this is the reverse. So sometimes on an exhale, everything is letting go and relaxing. So when you go to sneeze or cough, which is a forceful exhale, your pelvic floor is like, I don't need to work. I don't need to do anything. And then we get some leaking.
Yeah.
If we can teach you how to breathe and start turning on these muscles with the right timing, sometimes that might fix your leaking altogether. Once we get those things coordinated, perfect. So we want to look at your breathing. We want to look at your abs. We want to see, is there any abdominal separation? So that would be greater than a 2-finger width separation. And there's a specific way that we can measure that. Some OBs and midwives will assess you for that. Some won't. And even if we don't find any abdominal separation, that doesn't necessarily mean your abs are good to go and you're turning them on correctly.
Right.
So I like to remind moms, we are complicated human beings. So even your abdominal muscles, there's multiple muscle groups. You can hypothetically turn on your upper abs too much or your middle abs too much, or we're not turning on the lowers enough, or your obliques might be firing too much. We can have different patterns that our body has just kind of developed through compensations, through pregnancy, trying to figure out just how to live, that now we need to kind of unpack to balance everything out again. And this is where the early postpartum period, we need to have that mind-body reconnection period. So a lot of moms who I will see, 6 months down the line, who never ended up getting in to see a pelvic floor PT for whatever reason, but they feel like they've hit a plateau. They feel like their abs still aren't strong. Usually what happens is we need to go back to the basics and now retrain their abs how to turn on in the right way so that those muscles are now turning on versus my back is just kicking in or my hip flexors are kicking in. We need to get those muscles to turn on to then see not only the results from an aesthetic standpoint, but also from a functional standpoint.
And this is where I think to circle back to one of your points that you were making of that immediate postpartum recovery, and you even talked about your own experience within the first 2 weeks, is I'm not doing these high intensity exercises at that time. I'm focusing on my belly breathing. I'm focusing on cat-cow, on knee rocks, on reconnecting. And I always tell clients, look, you can get started right out of the go, but eventually you're going to circle back to this point. So we might as well just start at that point.
Definitely.
Yes. If you're in a certain mindset, like my athlete brains, they're
it's
like,
hard.
It's really, really hard because they're used to going and pushing their body.
Totally.
My response is, again, you're going to circle back to that point. And sometimes doing the harder thing, the turning off that go mode is really beneficial for you long-term to really learn about yourself too.
Yeah.
Because a lot of times women are getting their performance is based off of how well they are as a mom, how well they are is like when they are at the gym and working out. That's the only time they got the confidence.
Sure.
Well, now we need to look internal, reconnect and refeel. And then we're not saying you can't go back to lifting. She freaking lifts.
Yeah.
I'm lifting during pregnancy.
Yeah.
We share many clients postpartum pregnancy that are lifting throughout it.
Yeah.
It's just, let's make sure you're going back with the appropriate foundation and not letting, I think it was you at your workshop that I went to that talked about, let's get the foundation. Because if not, the house is going to blow over.
Exactly.
And then we got to rebuild the foundation.
Exactly. And the other cool thing that I find a lot of moms say, which they're always surprised at, is like, I never knew I could feel stronger postpartum than I did pre-pregnancy.
Yes.
And I would say this is also me. Like, I feel stronger now than I probably did when I was in college.
Really?
Granted, my sleep is different. My eating habits are different. I'm not consuming as much alcohol. There's some different things, different changes.
Sure.
But I feel so much stronger now. And it's cool to the mindset shift that we're kind of talking about. And I feel like a lot of things happen during motherhood. But being able to kind of shift priorities, shift our mindset. Unfortunately, we're not going to have hours to be able to dedicate at the gym. But moms leave my office and they're like, dang, my abs are sore from doing some marching. Like, how is that possible? I'm here to tell you, we don't need to do these crazy workouts to still benefit.
Thank you.
Still benefit from it and still get an effective workout. But I know it's a mindset shift. I know it's hard. I usually preface this first appointment telling moms, this is going to be more of a mental challenge for you than a physical challenge for you. It almost feels like you're trying to pat your head and rub your belly of, I'm trying to tell my abs to do this and my abs are not doing this. And it's not going to be perfect every time. So I see a lot of women, very
perfection
type A,
mindset, all or nothing.
Perfectionist. Yeah, I need to do this perfect every single time. My breathing is not correct. We're practicing these things.
Yeah.
The practice is the rep. You're practicing this 10 repetitions. I do not need perfect 10 reps. Our body doesn't need perfect breathing. Like sitting here talking to you, I'm not doing perfect.
I'm slouched.
I'm not doing perfect diaphragmatic breathing. My posture is not ideal. So we're not striving for perfection. Even when we talk about posture, even when we talk about what our exercises are going to look like, you're going to have a week where your baby's not sleeping. You're not sleeping. Your exercises might not feel good that week.
Right.
That is okay. Start new the next day. Start new the next week. Maybe it looks like we do an exercise in the morning, we do an exercise when they're napping, and then we do one exercise before they go to bed. That might look like your exercise for the first few weeks, and that is okay.
Right. And I think it's important too, as a client or a patient, that you advocate for that too. Because what I'll notice is, so sometimes they'll see a provider and then they'll come to me and they'll be like, they want me to do this, this, and this, and this. And they kind of gloss over. And I'm like, did you tell them that's too much?
Yeah.
Did you let them know? Because more likely than not, again, when we talk about finding the right fit for you, if you go, hey, I don't think I can keep up with 8 exercises.
Right.
Some people can. Some people like, got it. I'll do it all day, everything. And that's fine too. But some people, it's like, let's just start with 2. So you do need to recognize too of what is your capacity.
Definitely.
And if your capacity is 2 exercises, but you're thinking like, I just got to get back to working out how I did.
Right.
Then you got to have a real reality check there too.
Yeah. And I'm so glad you brought up that point, because brand new PT Kaitlyn, oh my gosh, I would give my patients like 20 exercises.
And the printout with it too.
All
with the guy
handouts,
and the video.
everything.
Oh.
Because, and I get it.
Because you want to be like, here's your information. Here's how you can get better.
And you're coming from a good place. You're like, these 20 exercises are going to make you so much better.
In your defense, brand new personal trainer Amanda was like,
we need to do everything.
Yeah, I'll tell you your homework. If you do this every day. Oops, sorry. If you do this, and then I realized, and then they come back and be like, no, I couldn't. I'm like, why don't we do 1? And then I got a lot more response with 1.
Yes.
And then they look at you like, you dumbass. Only 1. And I'm looking at you like, you dumbass.
Yeah. And so then as I have evolved and morphed into pelvic floor PT currently, and after being a mom, going through it, my brain can also only handle so much information.
Yeah.
So I can tell when a mom is sitting there holding her baby nursing,
Boom.
I'm giving her information, and I see her eyes glaze over. I'm like, okay, and that is it for today.
Let's go.
Let's recap. Let's see. These are the 3 things I want you to try to focus on. Let's write this down in your phone. Pull out your phone. We're going to write this down. We're going to put your reps and your sets, how many times you're going to do this. And then you're going to come back and see me, and you might be like, I didn't do any of that. And I
totally
go,
fine.
I know.
Yeah.
And you're in here today, and we're going to do those things again. So
totally fine.
I think that's so great to have those open lines of communication. I like to give people the benefit of the doubt. You know, your PT is trying to help you. Your personal trainer is trying to help you. We want to give you all these resources, but we only get to see you for maybe an hour. We don't necessarily know all the other appointments that you're going to, all the other appointments your baby is going to. Maybe you have other kids.
Going back to work too, taking care of your relationship too.
Oh my gosh, there's so many things. So you might be like, just give me 1. Just give me 1 thing. And if I can do that, the next time you give me 2 things.
Yeah.
But realize though, if we only have the capacity to maybe do 1 or 2 things, that might then dictate how quickly we're going to get back into, say, running.
Oh, good point.
We still then need to make the foundation, do the foundational work to get back to running.
Right.
The timeline is not linear though. So maybe these first 6 weeks, you're like, I am drowning with this newborn. This is really freaking hard. This was me. Okay. You might feel like you have no time to do anything. So in the 6 weeks, you're like, oh my God, I didn't have time to do anything. That's okay. Let's start at 6 weeks. Now you might have a little bit more capacity. You might be like, okay, I've got a rhythm. Okay. Now I can do 3 exercises. Great.
Yeah.
But we still need to lay the foundation for your core, your pelvic floor, your hips, impact before you get back to running.
Yes.
So I know this is very gray and we're kind of oscillating back and forth here.
We're riffing. Go for it.
But I want to kind of there's a lot of thought process that goes into this of what is going to be the best path for you, and what you think it might be might not actually how it is. Me on the other side of things, I can very easily be like, it's going to be okay. It's going to be okay. You're going to be fine. But when you're in the moment, you're like, this isn't going to be fine. I'm never going to get back to running. I'm never going to look the way that I was. I get that. I've been there. I'm here to help you through it. We all are. We will work together as a team to get you to achieve those goals, but it's hard.
It's really hard. Well, and because I've had clients tell me like, how could you relate? You haven't been pregnant and you're working with these kinds of people. I'm like, you're totally right. but I have had surgery and where I've had a point of like, oh, I've got to like do the bare minimum in order to get back to lifting how I want to. And that honestly, it was one of the pivotal moments of my life.
Yes.
Of like, I have to change my structure of my mindset of what this actually looks like for, I don't want to say success, but progress, right? Because success is so indefinite. Like you get to what you thought was successful a year ago and you're like, I'm not successful yet. Like let's move the needle.
Right.
But it makes you realize like, no, I understand, like, because I haven't been in that position. Luckily for you, you've been in that position twice. I'm like, I haven't been there, but I've had a similar experience of how I know how you feel.
Exactly.
And it's so disheartening. It's so discouraging. Yes. But that's where I say open communication with the people you're working with. You have to realize that there's a certain type of personality that gravitates towards these fields.
It's true.
And caretaking, empathetic, probably a little bit of boundary issues. Yeah. So.
And remember, DM me anytime.
Yeah. That's what I tell it to my clients. On the weekends, fine. And then they'll be like, it's the weekend. Why are you working? I'm like, because I can't leave you hanging. Yeah, I can't. So again, pros and cons of that type of personality, but the pro is on your side because we are there for you. So like Kaitlyn was saying is, I know you're not going to do it. And that's okay. Because when you show up disappointed in yourself, I'm not disappointed in you.
Totally.
And I don't want you to think, because what a lot of clients will do is project their disappointment that they feel about themselves onto what they believe you're thinking. And it's like, no. Let's talk about how you're perceiving me, because you're perceiving me as a parent, not as a support. And we've got to work through that.
Yeah.
And so there's a lot going on there. And so I'm really glad that you touched on that point of, hey, it's not linear.
Yeah.
And it's okay.
Yeah. And going off that too, I'll have moms who will email me and they'll be like, I didn't do any of the exercises. Let me push my appointment back. And I'm like, no. You come in today. We are doing everything that we did last time because this is what you need. This is what you need right now. Maybe you might just need to talk for an hour.
Yeah.
Maybe we're going to breathe a little bit, but you're going to leave feeling so much better. This is your time.
Right.
Let it be your time.
It's already scheduled, babe.
Yeah. No matter what that might look like, it might be different than what you thought it would be, but this is what your body needs for right now.
Got it. So I want some taboo topics.
Okay.
Let's do it. I know, because we've touched on them, but I think let's get some nitty gritty on them. So the first one, and actually when I interview providers, I send them like, hey, these are some questions that we'll go over, some topics. If you want to riff anything, you go for it. So you ordered them differently. And then I was like, there's a reason for that. So the first one that she puts is Kegels. So Mike, go.
Okay. Let's talk about Kegels.
Okay.
I don't think they're terrible. Okay.
I do.
I know there are people that are like, Kegels are the worst. First, let's define what a Kegel is.
Yes.
Okay. When I'm talking about a Kegel, I am referring to a pelvic floor muscle activation. So what would this feel like? And the easiest way that I feel like to describe it is it's the sensation of if you are trying to pull a blueberry up into your vagina. Ideally, the front part of your pelvic floor muscle, so that pubic bone part to the two sit bones, makes kind of a triangle around where that urethra is, around where that vaginal opening. That's going to get the front part of your pelvic floor. There's a back part of your pelvic floor too, around the anal opening. So that sensation feels like you're trying to stop from passing gas. Both of those parts need to be able to squeeze, and we need to be able to have a lift. All of that is a Kegel. So oftentimes people either aren't aware of what a Kegel is. They just think, oh, I just squeeze down there.
Right.
The second thing is most people are not doing it correctly.
Yes.
So we didn't talk too much about the pelvic floor layers, and there's different sides, and it's very multifactorial, right? But hypothetically, you might be able to turn on the back part of your pelvic floor really well. So this might look like I clench my glutes all the time.
Butt tuckers.
You're sitting with your glutes tucked under, but you might not be able to turn on the front part of your pelvic floor at all. The front part might need the strengthening, but if you do Kegels, you're just going to make those tighter muscles tighter. I also have a subset of moms who they push out when they think they are drawing up and in. So you're doing the opposite, okay? We do, just like I was explaining that bicep example, those muscles do need to lengthen and they need to contract. They need both. But our pelvic floor is not just an isolated muscle. It needs to work with the whole core system, like we talked about, the diaphragm, your abs, your back muscles. So when we're working on pelvic floor function, it is more beneficial for your pelvic floor muscles to do an exercise that's going to get everything on board. There's some good research that's showing like doing bridges, doing lunges, squats. That might activate your pelvic floor muscle more than you just sitting here trying to activate those muscles.
Yeah. And so just to backtrack, the Kegel is the thing you did in high school to tighten your vagina. That's essentially what it is. But what we're getting at is we need to unlearn that process to do it appropriately. Right. And so what's happening is do the Kegels. That's what's going to help solve these incontinence issues or all the pelvic floor issues. And it's like, it honestly might be that you need to relax and we need to actually learn how to turn on the front and not the back. But if we're just doing Kegels, because we got them off the internet or wherever, that's what we're talking about.
Or maybe your provider just said, do your daily Kegels. Like if you're trying to build up leg strength, the answer is like, just do your squats. Like there's a million exercises to do for your legs. That's how me as a pelvic floor PT is. I'm like, just Kegels? That's it? Like there's so much more to it than just doing your Kegels. So very, very few people I will give just a Kegel to. I do need you to know how to turn those muscles on, what it should feel like. But your pelvic floor should be automatically turning on just like your abdominal muscles. So we need to get to the point when you sneeze, those muscles are closing automatically, not you thinking, okay, I need to squeeze them and lift, then sneeze, which sometimes we do need to do early postpartum. We need to tell those muscles, hey, I'm going to sneeze, turn on, squeeze and lift, then sneeze. But eventually those things need to happen automatically.
Yes. So we touched on peeing pants is not normal, right?
Peeing pants is not normal.
There's a solution for that.
There's a solution.
We touched on lightning crotch.
We did.
And there's a solution for that.
There is.
This is common things that are out there. And that's why I was like, I need you to address these, but we've kind of addressed them along the way because I do want to make sure we talk about like outreach and education because I think you do such a good job of that. So
thank you.
Tailbone pain, you want to elaborate there?
Yeah. Okay. So tailbone pain, I think there's a misconception too between where the tailbone is, where your low back is, where your sacrum is. So your tailbone is at the very, very tip, the very, very bottom. And it's kind of like right at the top of your butt crack. Okay. That's where that pain is. We can get tailbone injuries from birth. So if you pushed laying on your back, sometimes that tailbone can sustain injuries. We can get little fractures in there. You can break your tailbone. So just from birth, we might have some trauma there. We can also get tailbone pain during pregnancy, okay? Your pelvic floor muscles, like I mentioned, attach onto your tailbone. So if the back side of your pelvic floor is very tight, so you might be, and tight is not necessarily a good thing. I think that might be something that's coming up. We'll get there. Just because there's tension in those muscles, that might be pulling on your tailbone, creating pain. That we then need to release those muscles so that tailbone isn't being pulled in a position that doesn't feel comfortable. And then postpartum, a lot of times we're leaning back, feeding our baby. We are leaning back in bed.
So
we
butt
are
tucking.
Resting. Yeah. And so we constantly have this pressure on our tailbone that we finally can lay on our belly again. Lay on your belly, lay on your side. Take some of the pressure off of that tailbone if it is very sore. So no, it's a little bit positional, but also it's probably related to your pelvic floor muscles that we need to address that in order to make the pain go away.
Okay. So as we alluded, tightness equals better sex.
Not necessarily.
As one that experiences a tight pelvic floor, it does not.
So, and I think a lot of times when you think of it from an anatomical perspective, we think that we need those muscles like this.
Like
Okay.
it's gripping the penis.
Right. Exactly. If those muscles are gripping so hard, it might make it hard for something to go in there, and that can cause pain. Just like you get kind of knots up in your neck or trigger points, you can get those in your pelvic floor as well.
Yes.
So if those muscles are tight, that can cause trigger points. And then when something is touching that spot, it gives you pain. So do we need the ability to squeeze those muscles? Yes. Do we need the ability to relax those muscles? Yes. We need both. We can't have too much of one or the other. That's not necessarily going to mean better sex for one or the other. We need both. We need both of them to function properly to have enjoyable sex.
Okay. Hemorrhoids.
Hemorrhoids. Ugh. They're the worst. They are the worst. Okay. One of the best things I think we can do to prevent hemorrhoids is minimizing constipation.
Okay.
We need to stay regular. And what do I mean by that? Pooping daily, pooping every other day, the frequency can vary, but the consistency of your stool, I want it to be like a ripe banana or soft serve ice cream coming out. It should be soft. It should be easily passing. It is when that stool is harder that then we need to strain and use more force to get the stool out. That is what is then creating the hemorrhoids. And through pregnancy, when we know we already have extra weight and pressure down there, that added on top of the constipation is kind of the perfect storm for hemorrhoids. Or during birth, when we are pushing with all of our might to get this baby out, that can lead to hemorrhoids. Or postpartum, hemorrhoids can happen. But I think the best thing we can do is staying regular, keeping that stool soft. Okay, so how do we do that? Please get enough water. Drinking at least half your body weight in ounces. I love adding electrolytes in. If you feel like you have water aversion in that first trimester, add lemon, add lime, drink coconut water, put some fruit in there. There's a lot of ways that you can get water in besides just drinking water.
Yeah.
I know that sounds kind of counterintuitive. But that water is going to allow the stool to be softer.
Sure.
Fiber is great, getting your fruits and veggies in. And again, I know in that first trimester, that might be the last thing you want to eat. It's about balance, okay? Do what you can, eat what you can. I also love magnesium citrate as a supplement to help stay regular.
Yeah.
And a lot of times it's hormones in our body that are making it more likely for us to be constipated during pregnancy. And again, I'm not a medical doctor. I'm not your OB. Technically, I can't recommend you to take magnesium citrate.
Me either, but
Talk to your provider about it. Again, I've never really had a provider that said not to take it, but taking a dose of that, maybe 2 doses, you're going to have to find out for you what works best, but that can really keep you regular. It can also help with muscle cramping and help you sleep a little bit better. Magnesium has a ton of benefits that I would much rather you take daily magnesium than Miralax and Colace.
I rather, even talking about the sleep rather than melatonin, even, there's a whole controversy on that, but like, let's kill 2 birds with 1 stone with that is what I'm trying to get at.
If we can.
Okay. I want to go into education and kind of outreach, because this is one thing that I feel like you do such a good job with. I mean, you do classes at Modern Milk, which is a local place. You're always on Instagram, sharing your experience, sharing your like practice and whatnot. How do we get people to buy in to pelvic floor PT? What has worked for you? What do you think is missing?
Yeah. So I'm hoping by now, just listening to this podcast, that you've learned something and maybe piqued your interest of like, maybe I should see a pelvic floor PT.
The answer is you should.
So I think for a lot of moms, they're a little nervous about what pelvic floor PT is. Like, what is she going to do? Are we just going to do Kegels the whole time? And obviously, if you've listened to this podcast, no, it's so much more than that. So I think one is just dispelling the fears of what pelvic floor PT is.
Right.
What do we do? And I think the most powerful thing is share your experience. Like, I love when I hear moms like overhear them at a coffee shop talking about like, oh yeah, I was leaking and then I went to see a pelvic floor PT. I was like,
I'm a pelvic floor PT.
Like,
I like the wand.
Yes, exactly.
Yeah.
Like,
Big fan of the wand.
Yeah. Talk with your friends about things that you are going through. And I know they're a little taboo. I see moms dealing with pain with sex,
Yes.
leaking, heaviness, pressure. They can't turn their abs on. So this stuff is like normal for me. These things hopefully should not be taboo for you. In the conversations though, then we can get the help that we need. Oh, I know this pelvic floor PT. Oh, I know this person that can help you. Oh, and I think just continuing to have that conversation about these things that we're dealing with, not only related to pelvic floor PT, but even for mental health as well.
Right.
Like, man, I'm really struggling. I didn't think I'd feel this way. Talk about these things that we go through with motherhood. I feel like once, we're pregnant, postpartum, you're in this like cool new like mom community that we all do want to help each other out and give each other the resources that we need. So you're not just dealing with these things alone. That there is help available. There is help out there.
Right. And we can't help if we don't know. I mean, I think for you and I, when we're seeing these people day in and day out, we can kind of gauge like something's up.
It's true.
And they start to reveal their little snippets there, the little cookie crumb there. And I'm always like, I will send you the resources. More likely than not, if you're working with a good provider, they're going to have plenty of resources because there's not, a lot of times what will happen in the medical community, and this is speaking from like my audiology experience, is there's a scarcity mindset of like, if I don't help them solely with everything, they're going to go somewhere else and then I'm going to lose that business. What I've learned, and I'm sure what you learned, I don't actually lose the business. I gain business because not only do I go like, hey, I saw so-and-so today. I don't know what to do with her anymore. Like I'm modifying so much of her exercises. She keeps complaining. I've encouraged her to see you. Can you just reach out? And usually that little reach out from me to the provider, to you, to them gets you in the door. So again, it's that being open with, it's so funny because we talk about all things nowadays, like everybody's an open book to some extent, but when it comes down to like pregnancy loss or pregnancy in general, or like leaking or like hemorrhoids or pain with sex, all of a sudden that stuff becomes the taboo. And it's like, well, let's not stop there. If anything, it's even more important because again, you are in this community. More likely than not, those people have experienced it in some way or another.
Definitely.
And there's always going to be one that found a solution, someone like you or a chiropractor that is there for them. And then that starts the chain reaction.
Exactly. And I think the other point is like, if you've been to pelvic floor PT, you've had a positive experience, please tell your OB or your midwife about that. I find that is the best way to start kind of changing the opinions of these providers. We have amazing midwives in Arizona that I feel like I've built a lot of really good relationships with them. So we're now referring patients back and forth. I haven't quite delved into the OBs yet. They're just harder to get into. But you as the patients going back to them whenever you see them to be like, hey, this was really helpful. I would encourage your patients to see them.
Use them as like a covert operation.
Exactly. Drop our business cards in the door when you go. Like I think a lot of times OBs, they don't know what we do. And so they don't see the benefit from it. Or I've heard it's trendy. Wait until you're done having kids, then go see a pelvic floor PT. You're pregnant. It's not going to help right now. So some of it is just they're not educated. They're not educated about what we do. Part of that might be just PTs in general haven't educated OBs to know, but you as the moms can hopefully, please go back to tell them I've had this positive experience. I would love to work with OBs. I would love for it to be a collaborative approach where we could all work together to get really great outcomes for your patients. And I know your OB doesn't have a lot of time with you. They might have 15 minutes. I get a whole hour with you. So if it's a quick, hey, go see a pelvic floor PT, they'll deal with all of that. Hopefully it'll make their job easier too.
I know one of my life goals, just to share this with you, is to have like a ground rounds, like collaboration on like, we'll say Friday afternoons where we all get together, maybe order in some lunch and the OB's there, the pelvic PT's there, the chiro's there. And so we just bring up like, hey, so Karen this week, like, okay, so I saw her, she's going to see you next week. Like that's my like dream of.
That would be so cool.
Of like, why can't we do that?
Like how well taken care of would you as the patient feel like, I have all these people
who meet about me and like talk about me
about
in a positive way.
Positive way.
We're not talking shit, but just like, like, hey, I saw this and she's having a really hard time struggling. Could you help reinforce this with what we're trying to do?
And like, that's been the cool thing about working with you too. Like I very quickly came to learn, like, I can't be everything for every patient. It's impossible. I'm a pelvic floor PT. we will touch on exercise and we'll touch on nutrition and we'll touch on sleep and we'll touch on all the things. But then I want to get you to the provider who then is going to best help you with that. So maybe that is working out with Amanda. Maybe that's a specific chiropractor. Maybe that's a massage therapist. Maybe that's an acupuncturist. So we use these resources so that you can find who that person is that you need to work with. But then we can all be in communication for, okay, this is what I'm finding. What are you seeing? Are you seeing that? Does she need to do more of this?
Yes.
So that you're getting really good care.
Well, and I think to that note too, of just an appreciation of the community that we have is just because like I'm on her roster for personal training, but I'm not the only one on your roster.
Sure.
Some client is going to be a better fit
for
some another.
Yeah. PTs. Let's hope you've got a good roster of those too.
But like, honestly, it's like some people just are a better fit. And you as being the first touch point, they're telling you as the patient, like, this is who I best think you would think of. And they'd be, oh, I saw so-and-so. It's like, that's fine. You can go see her, but I'm recommending because I know their personalities as well. So that's something I did want to bring up for you of like, you're very good about going this here, that there, and finding everybody's kind of working relationship.
Yes,
we'll
exactly. And
like Tinder matching.
Totally. And like,
Tinder match.
And you get it too. Like, I don't get offended if I'm not their fit.
Right.
You know,
me either. I'm like, it's probably better.
Right. Like you want it to work for both of you. Like
yes.
I firmly believe there's enough women in Arizona, in the world, we can all work with. Find someone that you work well with. And this is also for your provider. I see moms who are so loyal to this OB that maybe they had with their first and they had a terrible experience and they're seeing them for the second. Please find someone else.
Go somewhere else.
Find someone that you connect with. You want that birthing space to be the people that you love the most, that you respect the most, that you feel comfortable with. It goes for everything. You know, you are paying these people a service. Treat them as that. If they're not working for you, please go find somebody else.
Well, let's wrap up.
Let's do it.
You got to get your hair done, girl.
I do need to get my hair done.
Get hot for the weekend for your honey. So tell us, we can work with you virtually. We can work with you in person. How can we find you? What's your Instagram? What classes do you offer? Do you have anything upcoming that you want to shout out?
So find me at thriving.mamas on Instagram. That is probably where I am the most active. You can email me at hello@thrivingmamas.com.
Mamas is spelled MOMMAS
yes,
too.
Thank you. Mamas, MOMMAS. I teach a mama core class at Modern Milk, which is in Scottsdale, every Wednesday morning at 9:30. And you bet we are learning how to breathe. We are engaging our abs. We're talking about our pelvic floor. We are stretching. We're doing all the things. You can also bring your baby. It's for pregnancy and postpartum. So if you're like, I would love to work out, I'd love to be with other moms, please join us. I talk at the Happy Mom School there. So it's an 8-week.
I signed up for that.
Yeah.
In January.
Yeah. So that could be a whole nother podcast of building your community. But I find, you know, they bring in speakers every week that talk about different topics, but you're put in a group with other moms whose babies are all around the same age as yours. And like I talked about at the beginning in Australia, that moms group, like, man, it is such a lifesaver to be able to text those moms, like, is your baby sleeping well? Have you started solids yet? How do I get my baby to sleep? Like, you want that community of moms to be able to go through the trenches with you. And so, yes, I speak at the Happy Mom School there. What else? Offer in-person appointments, virtual appointments. I feel like I always have things up my sleeve that I want to do. I just wish I had more hours in the day to make these things happen.
Well, you have like online, what is it? Not on, I don't want to say like online training, but you have.
Yeah, so I have a workout guide.
Yeah, like workout guide. You have guides available.
Yeah, I have like a 4-week pregnancy and postpartum workout guide, some blog posts. I've got a lot of education on my Instagram. So I have little highlights of all the things we've talked about today, the first 6 weeks postpartum, SPD pain, SI joint pain, low back pain, all the things that we've talked about. Like, I just love educating about this. Very passionate about it, if you can't tell.
Hence why she's here.
But yes, please don't hesitate to DM me, email me. I love to connect with all of you and talk about all these fun things.
Great. Yeah. So Dr. Kaitlyn Kakar here. She will have her bio in our description. There will also be how to reach out to her as well. Now, if you like this podcast, please reach out and leave us a comment with positive reviews. You can find me at fitbyamanda.az on Instagram, and we are the Mindset and Matter Coaching. So we'll see you later.
Bye.